Hi, hello everyone. We are discussing one important CBME exercise, that is injury certificate and weapon examination. It is one of the very important exercise in FMT practicals as per CBME syllabus. In this video, I am talking about what are the parts of the wound certificate, classes of grievous hurt, weapon examination, lastly some important viva voce questions. Let's start with the wound certificate. The wound certificate, also known as injury certificate. So what are the components of injury certificate? It's a common exercise that carry 10 mark in your FMT practicals. What are the components? The first one, general particulars, carry half mark. Alleged history, need to write alleged history, 1 mark. Consent, 1 mark. Marks of identification, 1 mark. General physical examination and examination of injuries, around 4 marks. Investigation and opinion with the signature, name and designation, that carry 2.5 marks. So this is according to CBME syllabus. Let's see. This is the common injury certificate. You can see here injury certificate. Injury certificate, also known as wound certificate. You need to write like this: MLC number. What is MLC? Medico legal case number. Name of the hospital, the name of the patient, OP number or IP number, outpatient or inpatient number, the sex, male, female, age, address, brought by, relative or attendant or police constable, date of admission, date of discharge. Consent, the very important component of the injury certificate, should be a written consent. Then you need to mention two identification mark like scar mark, mole, birthmark. So any two identification mark for the identification purpose. Then history. So you can write alleged history. Alleged history of road traffic accident. Alleged history of assault at dash time, date, at particular place. That you can write in the this column. Okay. If patient is unconscious, you can take the alleged history from the attendant. You should specify the name and relation with the patient. Then details of the injuries. So details of injury is known as heart of the injury certificate. That you need to write clearly. Above person was examined by me on particular date, particular time, found following wounds. Again, you can see the columns here. First one is the serial number, then type of injury. What type of injury? Whether it is abrasion, bruise, laceration, stab wound or incised wound, or chop wound, or firearm wound, that you can mention. Dimensions. What do you mean by dimension? Length and the breadth. Sometimes in depth also. Like in case of stab wound, depth. Lacerated wound, depth also need to. So depth in terms of skin deep, muscle deep, cavity deep, or it is bone deep. Then location. So what is the location of the injury? You need to mention anterior part or posterior part, or you can write front of the body or back of the body, front aspect or back aspect, inner aspect or outer aspect. Like that, you can use common terminologies instead of medical terminology. Then time since injury, whether injury is fresh or of 1 day or 2 day or 3 day or 4 day duration, depending upon the color changes. So as we discussed in abrasion, bruise, there is a color change, classical color change. So depending upon the classical color change, you can estimate the time since injury. Then type of trauma or the object, whether blunt object or the sharp object. Blunt object that leads to abrasion, bruise and laceration. The sharp force that leads to stab wound and incised wound. And remarks. If any remarks can mention in the remark column in further examination needed. And here are some important points. Remember, while preparing injury certificate, an injury can be simple, an injury can be grievous, right? So the punishment for simple injury that varies, the punishment for grievous injury that varies. It all depends on the injury certificate or opinion given by the doctor, judged by the magistrate. So remember, it is on the basis of status of injury at the time of infliction, at the time of infliction or at the time of examination, not after medical or surgical intervention. This point you need to know. It is at the time of infliction, not after medical or surgical. Then you should prepare injury certificate or wound certificate in one handwriting with a ballpoint pen. Should be prepared in duplicate. Overwriting should be avoided. Medical terminologies should be avoided. One more component here, general physics examination, that is consciousness, orientation, pulse, temperature, BP, reaction to pupils. The consent taken from unconscious person or a disoriented person is not valid. So as we discussed, type of injury can be abrasion, bruise or laceration. All are caused by the blunt object, or it can be stab wound or incised wound of firearm wounds. Dimensions, length, breadth and the depth. Depth in terms of bone deep, cavity deep, muscle deep, or it is skin deep, like that. You can use magnifying lens also to see the margins, whether they are irregular, regular. So the question can be asked, irregular margins are seen in. Irregular margins are seen in case of laceration. In case of incised wound, they are clean cut. Then location, anatomical location, avoid technical term. So all these are important points. Then investigations. Then you can do some investigation like CT scan or X-ray. Then finally the opinion. So this is the important component. So in opinion, three things you must mention. Whether injury is simple or grievous. First point. Second thing, what is the age of the injury? Third thing, injuries are caused by whether blunt object or sharp force out. So opinion column you can see here, injury number dash are grievous, dash are simple. Why? Because simple injury carries less punishment. Grievous injury carries more punishment according to Bharatiya Nyaya Samhita or Indian Penal. Above injuries are fresh, again depending upon the color changes. If reddish in color, it is fresh or of dash duration, dash days duration or dash months duration. That you need to mention. Lastly, whether it is caused by a blunt object or it is a sharp force impact. So three important points in opinion. Then finally, place and date, signature, name and designation of the doctor. So this is about the injury certificate and the parts. So what is important here about the consent? Sometimes a question can be asked by your examiner. So what are the lines in consent? In consent, these are all the standard lines. I means that is the patient. Need to mention the patient name. Son of with complete consciousness, free will, without any pressure, give consent for medico legal examination. I have been clearly explained about the examination. The result and finding could be in my favor or against. So this is the classical consent which is taken during medico legal examination. The consent should be written consent, written consent. Then sometimes the question can be asked, picture can be given. You need to write the injury in the injury certificate. Example, see here. What is this injury over the abdomen? So this looks like a case of road traffic accident. What you can see the parallel lines like this. So this is graze abrasion. What is the size of graze abrasion? Say around 20 centimeter into 10 centimeter. So it is present over the front of the abdomen. Okay, front of the abdomen. Like that you need to make the graze abrasion. Or sometime image can be given like this. What is this? This is contused abrasion over the front of the chest. You need to mention the length and also the width of the abrasion. Sometimes the injury can be like this. You can see what is the injury here. This is black eye. So some important Viva questions that is asked in your exam. What is 116 BNS? What is BNS? Bharatiya Nyaya Samhita. So that is grievous hurt. Very commonly asked question in your exam. What is grievous hurt? What are the clauses of grievous hurt? And what do you mean by dangerous injury? What do you mean by 8 clause of grievous hurt? All these are very common here. So grievous hurt, what is grievous hurt? The grievous hurt according to section 116 BNS, that is Bharatiya Nyaya Samhita, or 320 IPC, that is Indian Penal Code. 8 clauses are there. What is the clause number 1? Emasculation. Remember, the clause number 1 is applicable only to males. What do you mean by emasculation? Taking away the masculine power of a male, that is penetrating power during intercourse. So the loss of masculine vigor in male is known as emasculation. It is applicable only to the males. What are the examples? Like example, cutting of penis also comes under class 4. Castration or injury to the testis or injury to the spinal cord at the level of L2 L4 that leads to impotency or erection problem. So all this comes under emasculation. Emasculation, according to recent one of the judgment between state of Karnataka versus Shivalingaya, the squeezing of testicles can be emasculation because that can lead to impotency. Then the second clause related to the eye, permanent privation of sight of either eye. So it's a permanent privation. This word is important. It's not temporary, it's permanent. It can be partial loss, it can be complete loss. Privation means loss. Sight of either eye. Like example, injury leading to retinal detachment, gouging out of eyes, or retinal tear. All this comes under class 2. Remember, it must be permanent. Whether treatable or untreatable is immaterial. So the report is given by looking at the injury at the time of infliction, not after surgical or medical intervention. Then permanent privation of hearing of either ear. So example, perforation of tympanic membrane, privation of any member or joint, that is the fourth clause. Member. Here the question can be asked, what do you mean by member? See, thumb is a member of the body. Hand is a member of the body. An example is amputation of thumb, amputation of hand. So the member means a part of the body which has a distinct function. Okay. And one more point, it is not able to regrow. Like the loss of nail or cutting the nail, cutting the hair, it is not a grievous hurt because it can regrow. So any part of the body which is capable of performing distinct function, which is not able to regrow, is known as member. One classical example is amputation of the limb, amputation of the thumb. So again, a revision as we discussed, the class number 1, that is emasculation. So either injury to the testicles, cutting the penis, or injury to the spinal cord leading to emasculation. Second clause, as we discussed here, the second clause, injury to the eye, cornea, or the globe leading to permanent loss of vision. Clause number 3, what we can see here, so this is the tympanic membrane and there is a tympanic membrane perforation. Clause number 4, as we discussed here, in clause number 4, there is a amputation of the thumb here because of the road traffic accident or because of the assault or because of some other cause. So this is clause number 4, member. What is clause number 5? Before that, look at this. Newspaper headline of Times of India. Lover kill a man by squeezing test. Remember, it is an example for grievous hurt and also it leads to vasovagal inhibition. So it is punishable under 302 also. Clause number 5, destruction or permanent impairing of powers of any member or joint. The here important keyword is power. Like example, foot drop, wrist drop, or bone injury leading to contracture, leading to loss of power at the joint. So all this comes under, that is fifth class, that is destruction or permanent impairing of powers of any member or joint. Permanent disfiguration of head or face. Like example, scar mark, that can lead to disfiguration of the face, or cutting of the, that is the ear, or bone injury over the face can be disfigured. That is the sixth clause. So you can remember sixth clause, sixth sense, that is over the face. 5, that is the power star, power. Then 7, fracture dislocation of a bone or tooth. So even hairline fracture or fracture of outer table, inner table can be grievous hurt, or tooth dislocation can be grievous hurt. Lastly, the 8th clause. One very commonly asked question in your Viva. What is the 8th clause of grievous hurt? Your answer should be, 8th clause is any hurt which endangers life. Example, stab injury over the abdomen which endangers life, or stab injury over the neck leading to laceration of the platysma muscle can be an injury which endangers life, or which causes sufferer to be during the space of 20 days severe bodily pain. Severe bodily pain for about 20 days, or unable to follow his ordinary pursuit for about 20 days. Here, remember ordinary pursuit. What do you mean by ordinary pursuit? Ordinary pursuit means day-to-day activities. Example, going to toilet, having breakfast, having food, taking bath. All these are ordinary pursuit. Remember, not going to work, not able to work for about 20 days, it is not a grievous hurt. The word is ordinary pursuit. For about 20 days it is. May stay in hospital for about 20 days, will not be grievous hurt. Ordinary pursuit means day-to-day personal acts like taking bath, wearing clothes. Does not include going to work or running, jumping, or driving a vehicle. So this can be your Viva question. Now again just a revision. As we discussed the fifth class related to the power. So here is the case of burn injury, and what you can see here, the contracture due to burn injury leading to loss of power at the wrist joint can be grievous hurt. And one more is disfiguration of face, that is sixth. It comes under different IPC section 326A and 326B. Now what you can see here, the compound fracture of the bone of the forearm can be grievous hurt. Fracture is a grievous hurt. Lastly, unable to do ordinary pursuit for about 20 days can be grievous hurt. There are 8 clauses. Number 1, emasculation. Number 2, related to the eye. 3, related to the ear. 4, that is the member. You can remember 4th member. 5, you can remember 5 power star, that is the power. 6, that is the disfiguration of the face or neck. And the 7th one is the fracture or dislocation. The 8th one consists of 3 important components. One is endangers life or severe bodily pain for about 20 days. Unable to do ordinary pursuit for about 20 days. All these are 8 clauses of grievous hurt. Question can be asked, what is emasculation? What are the examples? Now, some point about weapon examination. In some of the universities, they ask weapon examination. Can identify the weapon here? So this is the weapon. Can you see this? What is this? So this is axe. Axe consisting of some blood stains here. It is a heavy cutting weapon with a sharp edge. What is this? Chopper. What is this? Hammer. Heavy weapon with a small striking surface. Blunt object. Can lead to signature fracture. Weapon examination. How to write weapon examination certificate as per CBME. 5 marks. You need to mention addressing IO, the reference and the subject, details of receiving weapon from police, date and time of examination, name and type of weapon, weight of the weapon is 1 mark, then the description and dimensions of weapon, end of mark, lastly the opinion. So all these are the components of weapon certificate. Let's see how to write. So this is how you need to write examination of weapon. You need to mention letter number, the letter number acquisition number from the police officer, date of examination, and you are submitting the report to the investigating officer, and PS. What is PS? Police station. Subject regarding examination of given weapon or article, letter number, dated, and registration in reference to above case or PM report. Sometime PM report can be given along with the weapon. You need to write all this along with the sealed packet of the weapon. So whether case diary received, PM report received, MLC report received, FSL report, or any other document that you need to mention in the beginning. Then examination of weapon proper. You need to write on opening the packet, You need to write name of the weapon. Like example here, this is axe. Axe is recovered. Name of the weapon, that is the axe, heavy cutting weapon, a sharp edge, heavy weapon, or it is light weapon, made up of dash material, metal or dash material. What are the parts? If it is that, weight of that, whether it is a blunt or sharp, edges, whether single edged, double edged, serrated edge, or non serrated edge. Need to write. Then pointed or non pointed, whether hilt present or absent. If some lathi or bamboo or rod is given, you need to write length of the weapon, width of the weapon, or number of notes and distance between the notes. Also, if any blood stain or in material, rust is present or absent, any print of the weapon, design which is present on the weapon, that you need to mention. Dimensions as per diagram. You need to write a diagram of the weapon that is received. Finally, the opinion. The opinion after examination of above mentioned weapon and submitted document, I am of the considered opinion that injury, what injury? So injury number found on the body of the deceased as mentioned in PM report or injury report could be possible with the weapon submitted by the police. Could be possible or could not be possible. That you can write. So example, chop wound is there. So chop wound, yes, chop wound can be caused by, that is heavy cutting weapon, that is axe. Like stab wound, that is caused by the knife. Like that, whether could be possible or could not be possible. Weapon is received and handed over to police because it is one very important evidence that should be submitted in court of law for further investigation. Then you can write name and signature of the medical officer and the seal and the. So this completes the weapon examination. Now comes is the viva voce question. Like the question can be asked, what is BNS? Important BNS related to injury certificate. I discussed briefly about this. BNS means Bharatiya Nyaya Samhita. Is going to replace IPC. 114 BNS that defines hurt. And can be asked, what is hurt? Hurt means whoever causes bodily pain, disease, or infirmity to any person is said to cause hurt. 115 voluntarily causing hurt. 116 grievous hurt. 117 voluntarily causing grievous hurt. 118 voluntarily causing hurt or grievous hurt by dangerous weapon or means. So all these are important BNS that we can remember. As we discussed, 116 grievous hurt consists of 8 clauses. 8 clauses. So voluntarily causing grievous hurt, that is 117. Punishment is around 7 years of imprisonment. Voluntarily causing grievous hurt with a dangerous weapon, the punishment can be 10 years of imprisonment. Then question can be asked, what is dangerous weapon? So dangerous weapon can be any weapon which is used in shooting purpose, like example firearm, or stab injury, like example knife, or any weapon which is used in cutting, example knife, chopper, or it can be axe, or any weapon or any heated substance can lead to burn injuries, or any poison or any corrosive substance, example acids or alkali, or any explosive substance, or any poison, like example snake venom also. All these are dangerous weapons. Dangerous weapons. Here examples are axe and the firearm, that is revolver. The question can be asked, what do you mean by dangerous injury? The dangerous injury, it is not defined in any of the BNS or IPC. The dangerous injury is the one which endangers life. Example, head injury. Head injury leading to loss of consciousness, leading to vomiting, leading to other neurological signs can be dangerous. Penetrating injury to the neck, leading to damage to the platysma, so neck that consists of neurovascular bundles. So damage to that can be dangerous. Stab injury over the abdomen, piercing peritoneum, rupture of internal organs, liver rupture, spleen rupture can lead to extensive hemorrhage and death. Or thrusting lathi into vagina or anus can lead to vasovagal inhibition and death. Hemorrhage more than 1 liter, burn more than one third of body surface area. All these are example for dangerous injury. Next question can be asked, what do you mean by Wong Baker pain scale? This is the pain scale that is to determine severe bodily pain while giving report under clause 8. You see here 0 means no pain, 5 means worst pain. This is WB pain scale. Last question, what do you mean by ordinary pursuit? As we discussed, brushing teeth, shaving, going to toilet, taking bath, wearing clothes, combing hair, taking food, all these are ordinary pursuit. Last question, need to answer in the comment section. Question is, a Gabbar Singh causes a scratch abrasion over Amitabh's cornea leading to permanent scar, results in partial vision loss. Gabbar Singh offers for a cornea transplantation, and Amitabh is now doing well. Now his vision is normal after cornea. So, true about above scenario. Options are, Gabbar Singh is not guilty as he agreed to pay expenses of cornea transplantation. That is option A. Option B, he is not guilty because vision loss is temporary and partial. Option C, Gabbar Singh is guilty of hurt. Lastly, Gabbar Singh is guilty of grievous hurt as per BNS. So, write your answer in the comment section, whether A, B, C, D, like that. Thank you. Wish you all the best.